On the lighter side, when man evolved from the primates, earlier he had a tail. As man evolved and as he started losing the tail, there used to be tail transplant surgeons. And when more and more people started losing their tail and tails went out of fashion, tail transplant surgeons became extinct. And the same thing is going to happen with hair transplant surgeons as more and more people lose hair and as hair goes out of fashion. It won't happen now. It will happen in the next 1 or 2 generations. But it is sure to happen. So how did you like that story? Doctor, I am 22 years old and I want to get my hair transplant done. Can you please do it for me? So there are many times that a hair transplant surgeon's endurance is tested and he's almost pestered to get a hair transplant done, both by these patients and their parents. Because the effect of hair loss at that age is so huge, emotionally, psychologically, physically. Those are the times when a hair loss patient is studying. That is the time when he is working hard to get a qualification. And that is usually the time when hair loss sets in and it gives him untold misery. So he likes to have a hairstyle which is akin to that of his peers, his compatriots in his college, in his class, or at his place of work. So he tries to pressurize the doctor. Sometimes the patient will tell you that he wants to commit suicide. Well, that's a red flag sign, and that is one time when you should never do hair transplant. A patient who has got suicidal tendencies and who's trying to force him to get a hair transplant done is a red flag sign. And never succumb to the requests of a patient. Whatever he might say, whatever he might give to you in writing, the onus lies with the doctor. A doctor cannot do anything that his patient dictates him to do. For he is required to have that forbearance and that knowledge. It is not like any other profession. Here, if something goes wrong, a doctor can be taken to task just because he did not use his knowledge in the right manner, knowing fully well how it's going to turn up for the patient. So a hair transplant surgeon cannot afford to succumb to patient pressure to do a hair transplant before the age of 25. In the last about 20 years that I have been doing hair transplant, I have noted, and many other people have also noted, that the type of donor hair in your scalp has over a period of time declined. The type of patients that I had 20 years back is not the type of patients that I have in majority today. Today, more and more people have a lot of miniaturization of the donor area, which wasn't so many years back. Out of every 10 patients I see, there are about 3 or 4 patients in which I feel that this procedure should not be done. More miniaturization is being seen increasingly over the past few years. And what is the reason? Why? Because baldness is a part of the evolutionary process. Man is evolving. So any organ or any vestige, any integument human being does not need, nature has a way of doing away with it. And so we are losing our hair. What is the right age to do a hair transplant? Why don't we do a hair transplant at 22? When a person is 22, usually he has very high and irrational goals and objectives from a hair transplant. His expectations from a hair transplant are not rational in terms of the density and the coverage that he will get. He wants a head full of hair with all the density, with all the coverage that his compatriots, his friends, his friend circle, his peer group has, not knowing what a hair transplant can do for him and what it can't. On the other hand, there's a 35-year-old person who is content with moderate coverage. At his age, he can well understand the limitations of hair, and a little bit of thinning in the crown area he will not mind. A young person, on the other hand, who is grade 5 bald at 25 will expect full coverage of the crown. He will not compromise because he's irrational. Not that it is his fault, because at that age, hair means a lot to him and he's psychologically, emotionally ravaged. Now, if a patient comes to me at the age of 25, if he has up to grade 3 pattern baldness and he has a reasonable donor, I will do his procedure. But if he has upwards of grade 4 baldness and with a moderate donor supply in the scalp and evidence of some miniaturization, I would like to defer his hair transplant till he's 27. Why? Because I would like to see whether his donor area is stable, whether the hair that is in the so-called permanent zone will last him for a long time. They will not fall off. Because a hair transplant surgeon would not like the patient to start on a journey of hair restoration when he knows that there's a half a chance that it might be an exercise in futility. Because only the hair transplant surgeon knows that if the hair transplant is done at the wrong time, the patient will lose those transplanted hair in a few years. And this event, when it happens, is much more devastating to the patient than it was when he started on this journey. But not only because he lost his hair, but also because his donor area has started to thin. And when it started to thin, it's now appearing patchy and the scars may get visible. And when this happens, there is no recourse. There is no revision available because the patient lacks hair. He lacks a donor area. So no hair transplant surgeon worth his salt would like to leave his patient so devastated after the patient has spent so much of his emotional energy, his time, and not to say the cost of a hair transplant over the many months, and he's waited to get a hair transplant. The hair grew, but then now started falling off. He has undergone a roller coaster ride during his hair restoration process. And this roller coaster ride is a long journey. And at the end of the journey, if you don't reach your goal, you can be emotionally devastated. And this emotional devastation can be far worse than what he would have experienced if we had left him bald. So this is a word of caution. Anybody seeking a hair transplant at 22 should think twice. I don't think there is any respectable hair transplant surgeon in the world who will do a hair transplant in a person suffering from androgenetic alopecia at the age of 22. Not that when we tell a patient that your hair transplant will be done at 25 or 27, this is not a milestone. This is not written in stone. We tell him to wait for that period, not because we promise that we'll do a procedure on him at 25 or 27, but at that point of time, we will reassess. Not reassess with an insurance to do the procedure, but to reassess to know whether this person is a candidate for hair transplant or not. At 25, 27, we might tell the patient, sorry, you are not a candidate for hair transplant, because everybody is not eligible for a hair transplant due to various reasons. So what does a patient do if he is 22 and you have counseled him and he has agreed to bide time? So what advice do we give him? So I would advise that a patient, if his hair is thinning, he should not keep his hair long. He should trim it short, because in short hair, it doesn't show that you're balding. And with a baby look, you look much younger than you would with long hair. Also, I would like to put him on medical therapy. And for medical therapy, I would like to assess him, assess his emotional status, and assess what medicine will work for him or not. So now, what are the take-home messages from this video that you have watched? Number one, baldness is an evolutionary process. A patient at 22 has very high and mostly irrational expectations from a hair transplant. Number three, the scalp donor is not stable till you reach the age of 25 or 27. Number four, it is not possible, therefore, to assess the permanency of the hair in the so-called permanent zone till the patient is 25 to 27. At the same time, it does not mean that if the patient is 25 or 27, we will do his hair transplant. There is no promise involved. A badly timed procedure will lead to tragedy. It will unnecessarily distress the patient and his family, and also put your practice to stress. A good hair transplant surgeon will never succumb to inordinate pressure from the patient and his parents for a hair transplant, which, with the medical knowledge that we have, we know there's a high chance of failure. Well, thank you for watching, and please do not forget to subscribe to the channel. And if you have any comments, I'll be too happy to answer them. So leave your comments below and I'll reply back to you the soonest. Take care and stay safe.